Hi, this is Dr. David Tenner. I'm here at the Goldberg Clinic where we specialize in chronic disease reversal, and today we're joined by Ms. Carol Stein. Carol is from Alabama.
Orange Beach, Alabama.
Orange Beach, Alabama. And she came to see us last December 2018. Today is April 3rd, 2019. So we've been working with Carol for about 4 to 5 months. And Carol's here for her re-examination. We worked with her over email for about 90 days. And she's here today doing very well, and she's going to share her story. So Carol, I'm going to turn the floor over to you. Tell our audience what originally brought you in.
Originally I had lots of gut pain every day, every night. It kept me up. I wasn't sleeping. Eating just hurt every time I ate something. I was taking hormones. Last year in 2018, I tore a meniscus, went through physical therapy. I had breast implants removed. They were both leaking, so those toxins were in my body. Then that didn't make things any better. Then several months later, I had my gallbladder removed. That did not make things better. 2018 was just a terrible, painful, sleepless year. And my chiropractor in Orange Beach told me about the Goldberg Clinic. So I looked it up online, I read about them, called and made an appointment, and I am so thankful that I did. The last 4 months have been great. I am sleeping, I am pain-free. I'm probably 80 to 85% better than I was 3 or 4 months ago. I just can't tell you how happy I am that I am here. Life is good again. Life is really good again. And I look forward to the next few months and things just getting better and better, because it is truly just, like I say, so good to be alive again.
Well, we're absolutely thrilled with the good results Carol has had as well, and Carol's earned all those improvements. She's worked very hard at implementing the recommendations, and when we work with people, it's not just about taking pills and drugs and passive treatments, and we don't treat disease or treat symptoms. We get the patient doing the right things to get healthy again. There's a big difference between treating disease and building health. And one of the things that we were concerned about in Carol's case was the use of bioidentical hormones, which is becoming a big fad, primarily in functional and alternative medicine, where they'll take women like Carol having symptoms and put them on estrogen, progesterone, sometimes testosterone. And we've seen nothing but bad things come from that. I mean, Dr. Goldberg and I have significant concerns about the use of bioidentical hormones. We did a test on Carol to see how she was metabolizing the estrogen. There were some significant disturbances there. And when we see that estrogen is not being metabolized efficiently, that can contribute to the development of or increased risk for female cancers. It can certainly contribute to digestive disturbances, as Carol was experiencing. We've also seen patients develop autoimmune issues after having started bioidentical hormones. So we've just seen nothing but nightmares from it. And when there are hormonal imbalances with women, if we found, and men, if we do the right things and they get healthy, whatever hormonal imbalances they have balance out on their own as a result of getting well again. We just don't see it as a good approach to try to force the issue. So Carol, are you off the hormones now?
I have been off the hormones ever since you gave me the test, pardon me, the test results, and I am feeling so much better.
Certainly not the first time I've heard that either. Yeah.
No, and my thyroid medication has been decreased almost in half.
Yep, Carol's been on Armour for many years, and at this point she's probably going to need to stay on it just because the amount of years she has been taking it since she came in, since before she came in. But in cases where women or men have been on it for almost a couple decades or so, as they get healthy, in many cases they're able to lower the dose, which I always think is a good thing. We have seen people be able to come off of it too, but after 15 or 16 years or so, the body does become dependent on it. But nonetheless, less dose is better for sure.
And I'm just amazed at how much better I'm feeling after just 3 months following your program.
Yeah, it's much sooner than we expected. With the kind of history that Carol had, we had projected that she probably wouldn't be experiencing any significant improvements for maybe 9 to 12
9 to
months or
12
so is what we
months.
estimate, what we told her up front. So for her to be doing as well as she is, you know, she's well ahead of schedule. And again, it's a big testament to the fact that she's worked so hard and been so diligent in implementing recommendations, because, you know, as we tell people, we can't help people that aren't willing to help themselves. So with virtually everyone we work with, if they're willing to make an effort and be patient and go through some ups and downs in the process, there's usually a big light at the end of the tunnel for them. So
Well, I certainly cannot argue with success, and your program has sure been a success for me so far, and I look forward to the next few months.